cardiovascular heart disease in women, I didn't realize how high the statistics are. That is the leading cause of death for women in the United States. 30% of all female deaths is because of cardiovascular heart disease, and 50% of US females have some form of cardiovascular disease.
Hilda Lunderstedt founded and grew one of South Africa's most successful nutraceutical companies. She has won multiple awards for her dedication to entrepreneurship and empowerment. She founded and leads her Second Stage, a global movement helping accomplished women find belonging and deeper meaning in midlife. Caron Grossman is a registered nurse, author, and TEDx speaker whose memoir, Listen to Your Heart Song, shares raw wisdom on grief, resilience, and healing. A heart attack survivor who lost her mother at 13, Caron transforms life's toughest challenges into stories of hope and inspiration.
Caron, welcome for joining me today on this really interesting topic. And I'm really looking forward to having this conversation with you.
Thank you so much for having me.
The statistics are horrendous, yet there's hardly any talk in the media about it. There's hardly any education about it. And I am so excited that we can maybe raise a little bit more awareness. You have your own story. You're the survivor of a heart attack that you didn't even know you were having. And I was reading your book called Listen to Your Heart Song, and I was reading it with a box of tissues next to me, your story of your life story. So let's start with your experience around your heart attack and how it presented, and then we'll take it from there.
Okay. I always feel I have to start where I became familiar that women present different than men when having a heart attack. And that was when I was 13. My mom died suddenly of a heart attack when she was 39 years old. And she had been misdiagnosed over and over again. They kept telling her it was her hiatal hernia. She had symptoms like upper gastric pain, acid reflux, some fatigue, things like that. And they never checked to see if it was any different. And so I've always been aware that women present differently. And I've always been aware that women aren't always listened to about that. And what I ended up experiencing, like I do everything in my life today. I didn't always, but today I do everything I can to avoid this situation. I eat healthy. I move my body. I have good stress reducing techniques and all of that. So I really do not anticipate having a heart attack. And so I was talking to a friend and I got this weird sensation at the base of my chin, and it just shot up symmetrically to my ears. It was like an electric current that just went right up my ears. And then it diminished. It was like I could feel a dull something, but it was gone. And then a few minutes later, I had a dull ache in the back of my neck, the base of my neck. Nothing said heart attack. Nothing about this said heart attack. But I knew something was wrong. I don't even know how to explain that other than this wasn't your typical jaw ache. I've had jaw aches. I've had discomfort in my neck. I get a lot of tension there. I get that. This was different, and I knew I had to listen. And that's exactly what I did.
So was it just a little voice inside that told you this is different?
I've always been nervous when I have little aches or pains or this, like maybe a chest pain or something, because of my family history. And honestly, like this, I can't even explain it. I thought to myself, maybe I should go take an aspirin, because if you are having a heart attack, taking an aspirin is a really good thing to do. It can open up your vessels. I don't have any aspirin in my house, and I knew that, but that was a thought. So I did. I just started assessing myself. It's like, okay, I'm a nurse. I can do this. And still nothing said heart attack. And then it occurred to me, oh, women present different than men, but they don't really say how. And I mean, I knew people's jaw ached. I've heard that. But this was like an electric current. This was not an ache. This was not, and then it was gone. So I really had no idea. And just having that idea like, oh, women present different than men, what if it's this? What if it's just as simple as this? And the final thing, I remember diaphoretic, sweating. And I touched my forehead and I was like, it was a little clammy. And so I did. That's when I decided to call 911.
And then tell me that story. You describe it beautifully in your book.
I called 911 and I will tell you something. It's so much easier. Like if a friend called me, I'd say, call 911. But for yourself, it's really hard. It's incredibly hard to do that. And so I called 911 and the gentleman answered the phone and I said, I think I'm having a heart attack. And he immediately went into, oh, are you having chest pain? Are you having shortness of breath? Are you having pain in your left arm? And I said, yes, yes, yes. And I wasn't having any of that. And I just, all I knew was I couldn't take the chance that he wouldn't take me seriously. And so ambulance got there in 4 minutes, hooked me up to an EKG and they put an aspirin in my mouth and everything started moving.
Wow. And by which point did you know that this is it?
I think when the aspirin went in my mouth, like, cause I knew they wouldn't be doing that otherwise. And then I just started understanding what they were saying. And honestly, I understood the silence of what they weren't saying. Being a nurse, I've been in that situation and said the words they were saying and had the silence that they had. And it really became so real when I was in the ambulance and they called in that I was having a heart attack. I mean, I understood that. But they called into the hospital that I work and they said, we're coming in with one of your own. And it still makes me very emotional because it just became so real and it became so real that I was part of a community and I knew I was going to be taken care of. I just knew I was going to be taken care of. So at the same time of knowing this is happening, which I couldn't wrap my head around, um, I trusted. I trusted.
Is that when they say the world slows down and you just have to surrender? I would imagine it was pretty hectic when everybody is shuffling around you.
It was actually kind of fascinating. There was a paramedic. Her name was Chris, and she had these clear, light, I want to say green eyes. They might have been blue, but they were these very clear, and she did not take her eyes off of me for a second. Yet she was running around my kitchen, putting things in my purse, and I wasn't even aware of what she was doing. And then when I was at the hospital and I got to my room, I had my ID, I had my phone, my charger, my shoes. She put everything in my purse, but she just kept talking to me and keeping eye contact. And so what everybody else was doing around me, I really did. Each step I did surrender. I made the 911 call, I surrendered. They arrived at the house, I surrendered. Each time it got deeper. Because what else am I gonna do?
Yeah. So you were really forced into your surrendering process. And then, obviously the recovery, we're so happy that you survived and that you are here to talk to me today about it. You also described the the recovery process, not just the physical, your body recovering, but almost the bigger recovery around the emotional recovery and the fear, the anger, betrayal. And when did that start coming up? As I was reading your book, you just trust in your body. You don't think that your body is this gonna, I'm going to use your word, betray you.
Mm-hmm.
And and that's on top of many other betrayals we often have in our lives and that you also describe. So at what point did those emotions start coming up for you that you had to start handling? Because it seems to me there's a pre-heart attack and then the post-heart attack person and what you need to deal with.
Yeah, no, I'm so glad you brought that up because it's not talked about enough. I had heard, and I don't know if I had heard this as a nurse or as just a person who knows people who have experienced heart bypass or all the whatever. But I had heard there's a depression afterwards,
Mhm.
and it came quickly. It came really quickly. First day, I was kind of elated I mean, it hadn't sunk in. I hadn't and my daughter was visiting me, it was very minimally visits, which was wonderful because of COVID. So they hadn't really opened up the visiting hours yet. And I'm so glad because I could not have handled the entertaining that people do, when somebody comes to visit. And so the first day I'd say I was pretty elated. I was kind of goofy. And I got a private room, which thank goodness. Yeah, I became very depressed, incredibly angry. Uh, the sense of powerlessness because I have done whatever I could possibly do to not be there. Like I was not supposed to have a heart attack. And so the anger, it was dark. It just became dark. And I've had depressive states throughout my life. I've had deep sadness. This really, I knew I would get through it. I didn't know how, I didn't know when. And there were times I wasn't sure I would. But I'm really blessed because I am in recovery for food and alcohol addiction. I have this incredible tools and recovery community that I didn't really want to use, but I did because I have to, that helped me. And I have a power greater than myself that I could lean into, because I don't know that I could have without that, and I had my kids. I mean, there's just things that reminded me that I could only go so deep. But even with that, like it was tough. I was angry. I was really angry.
Did everything hit you at the same time, or did it go in phases? You deal with anger and then something else come and then something else come, or was it just a mushy of everything?
It's interesting because anger, for me, I really believe anger is like an umbrella. We call it anger because most people know three emotions. They know happy, sad, and angry, and those are clear. You're happy, you're sad, you're angry. But there's so many dimensions to emotions. And when you have anger, chances are you're not necessarily angry. It's something below the surface. And over time, because I do write and I do explore and I'm always looking to get a greater sense of who I am, I was angry. But there was also a betrayal. My body betrayed me. I mean, I really treat my body well, and it betrayed me. I was reminded how powerless I am. I mean, you can do everything. I mean, I had a stress echo for my heart just for baseline a month before, just because of my family history, and it was perfect. And so there was just all these things. And then, I mean, I got angry. I ordered my oatmeal and I put salt in my oatmeal. And because I don't really eat processed food, I don't get a lot of salt unless I use it. And they refused to give me salt because I was on a cardiac diet, but they offered me sugar. Like sugar is toxic. I don't even eat sugar, but they were so free with sugar. So I was just angry at the system. It was just amazing all the things I could be angry at. And but really when I got down to it, I was sad, I was disappointed, I was embarrassed, which was a really uncomfortable feeling.
Embarrassed about having a heart attack?
Yes, isn't it? It sounds arrogant, and I don't mean it this way, but I did better. I mean, I did better. This was not supposed to happen to me. Um, Everything that I've done, and it still happened. And people like they were teasing me about it. It's like, oh, if it happens to you, oh, what's my chances? And they're like, they just were teasing me about how, see, that's what happens when you live a lifestyle like that. And it just, I don't know. It's a word. And it was interesting. A friend of mine's husband had a cardiac event and he too was embarrassed. He used the word embarrassed. And when I was talking to her about that, she's like, why? I go, I don't know. I mean, are we like superhuman and it shouldn't happen to us? I don't know. But that's kind of where it went. Like, I should have known better. I should have done better.
And like then that I should have known better, because if you did, you
I
would
know.
have done.
And still,
So So you say anger is your umbrella. Sorry, I'm deeping like into the emotions because I think there's a lot of people potentially recovering, hopefully recovering if they had a cardiovascular attack or incident. So just to make them understand that these emotions are absolutely normal and almost to
Normal.
be expected. Yes, and not to judge themselves. So if you say anger is the umbrella, which I totally agree with you, what was underneath that for you? I find for most people it's grief. I'm not sure what was under, was it the embarrassment or what was under your anger?
The embarrassment was just part of it, and that's probably one that I don't even experience anymore at all.
Mhm.
It's like it's gone. I was very sad. I was very, very sad. I did feel betrayed. I really felt my body just did not treat me well. And I knew these thoughts weren't necessarily true, but that's what I was feeling. I felt grief. I felt a great deal of grief that my life was going to look very different. I had moments of gratitude. No, I had more than moments of gratitude. I had a lot of gratitude. But one thing I've learned over the years is you can be very grateful and still unhappy. You can be very grateful and still sick. You can be very grateful and still something that you're facing a challenge. And I was and I am very grateful. I was disappointed. I was frustrated. Again, powerless was a big thing. I had no control. I had no control. And so there was grief in that. And yeah, it was a lot. It was a
And
lot.
what was your recovery process or does it go away? Is it something you just learn to live with?
Well, I'm really fortunate. I have a lot of tools and I leaned into them and that helped me. It did take time. And when I really put my finger, I mean, going back to work helped because I was now being of service. I now was not just left to my own dark thoughts. I had to help people. And that did help. Absolutely. That helped. And, over time, I became more adjusted emotionally, physically, because physically I was given a clean bill of health. I'm good. But I was scared. I was so scared that I was going to overdo. I was scared that, well, what if I'm like doctors like, no, push it. I want your heart rate up. And it's like, what if like it explodes something? Like I can't, I was so scared that I was going to push it too far. And, and the funny thing, and I don't know, and again, I'm just speaking with my experience. So I had the heart attack the end of December. They put me on a medication because I liked to a beta blocker to keep my heart rate in control, just so it doesn't get too high. But my blood pressure gets so low, they were having a hard time keeping me on it, and eventually they had to take me off it. And within 3 days, and now I was feeling better over those months. It was still dark. It still wasn't, I wasn't back to myself. But within 3 days of being off that medication, like the light just turned on. I had energy. I felt alive. I could feel excitement again. And so I don't know. Is it the medication? Is it everything you go through having like a near death experience? I don't know what it is. And I can only speak for myself that that was my experience.
It must have been scary going off the medication, like the crutch is like leaving and not knowing how your body is going to react or respond.
Yeah, and I had a promise that I called, with any my cardiologist gives me a cell phone, you call for
Mm.
anything. And there are times I have, just for clarity.
So it's really the lesson in having to become dependent on other people and ask for help and all those things that we as women sometimes really struggle.
I haven't really looked at it that way, but you're absolutely right. You're absolutely
Yeah.
right.
So you mentioned you went for a test,
Mhm.
cardiogram, or is it an
It's a stress
ECG or stress
echocardiogram.
echogram? That was normal. And I think so many people, let alone women, do that and just trust that, okay, it's a normal outcome. I'm going to be fine. But it seemed that is not the case, especially in your case, it's not the case. What else should we be doing? Is there anything we even
Okay,
can be doing?
yes, there is. There are now With that said, the test was normal. The test was normal because it was normal. I was not having any issues. With what happened to me, the way it was described, it's like a pimple breaking through the skin. I had like a little pimple of plaque that broke through the artery. And what it did is it caused the clotting cascade to go into effect. So that itty bitty little clot that was really nothing, maybe 10, 20%, became a 90 to 100 within 2 days. So it was more of, the doctor called it a phenomenon, which I don't necessarily like that because that means it could happen again. But when I did go in for the echo and the echo was good, one of the other things that we were going to do is a calcium CT, which is a CAT scan. And this is something, it's out of pocket. Insurance doesn't cover it. It's about $150. And I say it's worth it. Unfortunately, I never had mine scheduled. I don't know what it would have shown because at that point, I didn't really have anything in my arteries. But what it shows is what kind of calcium, what kind of plaque do you have? And it's a score. And you can have a score as low as 0. So it's a really important test. And I really recommend it. I recently had a doctor's appointment and I asked him, I said, should I do it now? And I don't, because I have stents in my artery and it would just skew the
Okay.
test.
So should that be something women just do standard once a year, or when you think, or is there, when there's hereditary or familial?
I would
Because you
say
also don't want to
definitely,
become paranoid and just go and do.
if you think about it, a friend of mine just did it. She has no cardiac history in her family. She lives a very healthy lifestyle. But because of what happened to me, she's like, $150, let me go find out. And hers was 0. And so, they were talking, because I want to say she's 68, they were talking about putting her on statins, even though her cholesterol was low. And she didn't want to. And so this is what she did. So she didn't have to go on a medication. My daughter immediately got it after I got out of the hospital. And
Like you were saying, a little plaque erupted. So would they be able, with that test, be able to see if there's plaque and then your risk of it erupting? And
I don't know what the score would have been. And I probably didn't have it when the test would have been done. So it's kind of an unusual case, but it really is something. I wish I did do it. I would be curious as to what it would have said.
yeah, I was just wondering if you once a year do it, but if it's any benefit, it sounds like it's more the luck of the draw, really, around.
I don't know that I would say that, because what happened to me was more of a freak thing. That's
Okay.
not the norm. And
Okay.
so I would say it's more common to do I really would. I highly recommend it. And that's the number one thing. There's also another test you can do. It's a blood test, lipoprotein A. And what that does, it's kind of a cholesterol test, but what it does is it shows it at a level, like, is it genetic? Do you have this in your genes? Is this a possibility? And the thing with that, though, is there's really nothing you can do if you find out it's higher. There's all the things you can do if your cholesterol is high. There's eating in a different way, eating healthier, exercising, not smoking, even not drinking. There's all those things that can help. But yeah, I would say that the number one that I would suggest is the calcium CAT scan.
And I think diagnostics are getting so much better with AI analyzing all of the scans and stuff. So hopefully detection would be easier as we go forward.
Mm-hmm.
Getting back to women presenting different, and I'm going to get to your work that you're currently doing, but just what are the symptoms, women? I said men is like chest pain and left arm, and women don't have that. Or can they have it, and some have, some
Absolutely,
don't?
they can. Absolutely, they can have classic symptoms. And men may have lesser symptoms until it becomes something crushing.
Okay.
That absolutely can be. It's just more common that women present different than men. Men typically present with the classic, grab the chest. But a lot of times, if you look before that, they were having maybe some acid reflux or something. With women now, I was looking into this for a couple things. Now, some of the things there can be the chest discomfort, it can be pressure, can be an upper gastric pain. It could be shortness of breath. It could be all those things. It could be nausea and vomiting. It could be like an unusual fatigue. It could be the jaw pain. It could be an ache in the base of the neck. And so it could become complicated as like so many women. Of course I'm fatigued. I've been taking care of kids and I'm working and this and that. And the thing is when we have these symptoms, it could be flu-like symptoms. I mean, so where do you go with all that? What I really recommend, and the only thing is, because that's all I did, I was feeling something off and I took the time to listen. I didn't rush off to the next thing. So maybe if you're having this unusual reflux, this acid reflux that you don't usually get, this heartburn that you don't typically have, and you have a ache in the base of your neck that doesn't feel like tension. If we stop and listen rather than saying, oh, I've got to get the kids here and I've got to go do this, just take 30 seconds and listen. Am I feeling something is off, or is this, because no, we don't need to jump to call 911 for every ache and pain. I would never suggest that. I wouldn't do that.
Mm-hmm.
But we don't pause enough to listen to our body.
Especially as women, like you just said, I got to do this. I got to do this. How, I know you've developing the tools and not coaching people. How do we listen to our bodies? And how do we
That's such
know,
a good question.
how do we know what it's telling us if we haven't potentially done it for a lifetime?
Thank you so much for asking that, because I'm making it sound so simple. But
Yes.
I've spent years listening to myself in one form or another. And I think people do listen to themselves more than they give themselves credit for. Because, you've experienced that where you're driving down the street and something tells you to go left. You have no idea why. You always go right. Why am I going left? So you listen and you go. And then you find out there was an accident that you missed or something happened. And if we start practicing with the little things, we'll learn to listen to ourselves. There are no coincidences. And I think that was something that I had to learn early on. There are just no coincidences. And I don't want to say things happen for a reason, because that's not what I'm saying at all. Like, I don't believe that I had the heart attack so I could then write a book and educate people. That's not, I don't think one has anything to do with the other. But I think we can learn to listen when something, if we pause, if there's that pause, I don't know how else to explain it. If we just take that time, and again, 30 seconds, I'm not asking you to sit for a couple minutes, just 30 seconds, and honor who you are. Honor that we have this internal wisdom that is just innate, that we lose so early on, but we all have it. And I think it's just a matter of practicing. So what happens if you haven't practiced and something is going on? All I can say is pause. And, there was this, I remember working in the emergency room, when in doubt, rule it out. Let me tell you, I was so nervous about calling 911, going to the hospital I work at to tell me I was having an anxiety attack or something. I just would have, you want to talk embarrassed, I would have been really embarrassed. But we have to take that chance. Oh, we have to take that chance and
So the
learn to trust.
voice
Yeah,
sounds different when
it is
when it wants to
different.
warn you.
Yes.
Okay.
Yes.
It's not just the other voice there's a different voice that tells you, worry about this. And
Thank you. Yes.
why gastric reflux? Why is that a symptom? I'm just wondering, Was it
I'm not,
just,
the heartburn, I'm not really sure. I'm not really sure. But I will tell you, I was talking to my doctor because I was looking at why do women present different than men? What's the story here? And so I had an appointment with him a couple weeks ago and I asked him that. Now, this is a man who's been a cardiologist. I want to say he's late 60s, early 70s, late 60s, I'd say, maybe 70. And he's been around and he's excellent. I just think he is brilliant. And I asked him, why do women present different than men? And he said, I don't know. And I said, every bit of research that I looked told me why why we die more than men, because we tend to die because we don't listen. It's not that they're listening. They just are like, they kind of react in a different way. And again, their symptoms may be bigger, stronger, but women, we put it off. I could have easily put that off if I had something to do, or even if I didn't have something to do, but nothing showed me why. And as I was leaving the office, I'm in my car driving home and it hit me because they haven't done the research.
I was
They
just
haven't
going to
done the
head,
research.
I was just going to ask you, like, has research been increased on women? I was in some conferences and they talk, all of the medications is made for men. And then we just get an adjustment for females and maybe a little weight adjustment or whatever. But there's literally so little research for women specifically in most health conditions, even in breast and ovarian cancer, for which only women get, is there's way little.
I mean, that's a whole other topic and it's not because I wrote this book. It started out as an article. I'd been writing a book and I may come back to it all about, the grief of my mom and my adolescence. And then I had the heart attack and I was still working on the other book. But about a year before I really dove into this book, or actually a year before this book came out, I wrote an article. It was Heart Health Month, which is February. And I wrote an article for a local magazine and also for another online magazine that a friend of mine has. And it's actually the beginning of the book. That's the article. And my two aunts, my mom's two sisters, they're like, you have to do something with this. You have to do something with this. And so I did. I turned that article into the book. And that was not my intention, but I wanted to bring that into awareness, to make it more of a topic that we can talk about. Like I don't believe, for me, there's no topic really off limits for the most part. But I think we should be able to talk about pretty much anything that goes on in our lives, because once we shine a light on whatever the shame or the fear of what's going to happen, people just say, me too, in some form or another. And so what ended up happening with this book, where I started turning, was listening to your heart, learning to listen to your instincts, not just in your health, but in your life. And then it went on to advocate for yourself, because nobody else is going to advocate for you. And I am a nurse. I know what it is in healthcare. And even me, with a basic understanding of my heart, my body, when you're a patient and you're afraid, you're not collecting everything. So write down questions, demand, like, your time is just as important as the doctor's. And I say write the questions down for a couple of reasons. One, so you don't forget. When the doctor starts being kind of busy and hurried, and you start thinking, oh, I don't want to take up their time. You can forget the questions. So write them
Yeah.
down so you know them. But it also shows the doctor, like, wait a minute, I just have two more questions. Can we just go over them and make sure you understand the answers? Don't just nod and say, oh, okay, if you don't understand. There was so much I didn't understand. He
Is
talked
that
to
what
me like I was a
advocating
nurse.
for yourself mean? Is that preparation when you meet with your doctor annually and ask the questions?
Yeah, ask the questions. You have that right. You are worth, you are worth their time.
I agree with you, because I don't. You just listen to what they're saying, and then you get home and you think, why didn't I ask this? Or why didn't I want to still know this. I don't understand why they said something. But how do you change your nature? Because we as women do not do that.
And that's a part of my goal is I want to give permission. If you can't do it, let me give you permission. Or if you're not able to, bring somebody who is. Because extra ears, I think, is always important. But bring that person that may drive you crazy because they ask so many questions. Bring them. Bring them.
Yeah.
That's
a good idea, to bring someone along that can help you. Just a pair of ears.
Absolutely.
That can translate later on what was said in the meeting or in the
Absolutely.
consultation.
I remember going to the doctors with my dad and my stepmother, and my dad was the patient, the same cardiologist. And we left, and I said to my dad, and I said, "What did you hear?" And he told me. And then I looked at my stepmother and I said, "What did you hear?" And she told me it was a little more accurate what she heard. And then I said, "Well, this is what he said." And because they didn't understand the language and they didn't know that they should ask. And I'll tell you, I'm a nurse, but cardiology isn't that's not my specialty. And I'm a patient. So I'm like, wait a minute, talk to me as if I have a third grade, education, because I'm not following this. And they did.
And what else are you? Advocate for yourself, listen to your body. What else are you teaching or telling people?
So much of it is just the worthiness of it. I work in a 1-day surgery center, so I discharge patients, a lot. And I'm sending them home. And I always tell them, maybe not every single time, but probably 90% of the time, I tell them, no one knows your body better than you. Nobody. So if you have questions, and how many times people start a sentence like, I know this is a stupid question. No, it's not. No, it's not. We have the right to be heard. We have the right to get the information. And we're worthy of it. I think that's such a big part because you've said, we as women in particular, we're not raised to do all that, to speak up in that sense. So many of us are people pleasers. I don't want to take up too much time. I don't want to be too much. I don't want to be too much. We are just enough. It's not like be because that can save your life. And maybe it's not as extreme as saving your life, but maybe it can enhance your life. Maybe it can build your life. Yeah, so that's listen to your heart.
When you do it in one area of your life, you speak up for yourself in every other area of your life, because you'll just get that confidence. So it will benefit you everywhere in life to
Absolutely.
self-advocate.
And that, I think, has been my favorite part of this book is people see, I'm a digger. I always want a better sense of who I am. I always want to dig a little deeper. Not everybody does, and that's fine. But what I love, like my coworkers who read this book, people who I only know at a superficial level, so many people have come up to me and they share something they've never shared before. They use their voice in a way they haven't before because, I did, and I'm okay. And I tell people all the time, practice with me, practice with me. And because we have to use our voice. That's why we were given it.
In your book, you talk about, and I just quickly had to look it up. I forgot. It's like stop, listen, act.
Yes.
Is that what is stop, listen to my body, and then act accordingly?
Yeah.
Since your heart attack, you recovered, you took some time, you went back to work, and then came the desire to write the article, which now led to the book. And I think you did a TEDx and you're doing education around the awareness. There's a different passion or drive that suddenly has been born. And I don't know if it's from the experience or if it was always lingering. Just talk to me how life is now as a couple of years after 4 or 5 years after your heart attack. I know you're really professing for women and the symptoms are different and teaching. Is that just a voice again inside of you that you're listening to? And how's that playing out?
It's so funny. I said earlier about being too much. I always felt like I was too much. I mean, I always felt bigger than most people did. I was always, things were big. I was very dramatic too, but things were big. And I don't want to take it away. I don't want to say I was emotional or dramatic or anything like that. But I as a kid, and I see it now in my granddaughter, just very big. But I was so afraid of being seen. I was so afraid of being treated like found a fraud, imposter syndrome. So I had that for a very long time. And being in recovery and taking away a lot of the layers that I hid behind, what you see is what you get. And so now I'm not afraid of being caught. And I I don't feel like I'm too much. And I don't feel like, and I love to inspire. I love to educate. I love to give people permission to be themselves, to show them you can speak the truth and you're not going to be struck by lightning. You're okay. So the TEDx talk actually came about. I'm certified in end of life and grief coaching, and I got very involved in bringing that to the table. And this was before my heart attack. It was 2 years before, 2.5. And I did a TEDx talk on permission to grieve, and I loved it. It felt like the most natural thing for me to do. So in this, it's just having the book, it gives me a platform as without the book. It does, I don't have, it's like, hey, pick me, I want to talk. It doesn't help as much. And I love sharing this. I love educating people. I love, when I went back to work, I work in a hospital. I couldn't believe how many healthcare professionals, women present different than men when having a heart attack. Like, how do you not know that? Like, I get not knowing how because I didn't really know how.
Mm.
But I was really surprised at how many. Many did, but so many didn't. And it's like, oh, something needs to be done here. And the hospital I work for has been incredibly generous, giving me different platforms to talk and share and do that. And so that's been really great.
Do you think it's changing? Are there more ears listening and taking note that women are presenting different? Or are you and possibly a few other women with experiences just trying to do their best with whatever they can? The system is still rigged against it, or is it changing?
I think we are coming along. I think we're coming along. I think more people are listening, and I think we have a long way to go. I do. But what I surround myself with people that are talking or people that want to learn. For me, it sounds, yeah, people are just learning. Like people are, yes, this is part of the conversation, but that's because it's part of my conversation. So I can't speak on the bigger picture. I was really excited. My daughter's sister-in-law was in the hospital for upper gastric pain, and I went up to visit her, and she had a telemonitor on. So she had a monitor that was monitoring her heart. And my first thought is like, this 30-year-old who's clearly here for GI issues is being monitored. And then I thought, oh, they're monitoring her because these could be a symptom. I was so thrilled. It isn't her heart. It's definitely her GI, but I was so thrilled. But it took me a second. I'm like, why are they doing this? Oh, that's why. So yes, maybe they are doing a little more.
That's awesome to hear it. And especially in younger, really out of the range patient or target for heart attack. So maybe they are, and maybe the work you do and the work whoever else is doing, the advocating for heart attack victims is helping.
I have to believe that. That keeps me wanting to share. I have to believe that.
What
So
advice so many women have imposter syndrome, scared to play big, scared to be seen? Advice, one or two things can you tell women? How do we shed that?
what comes to mind, and this is something I have to do in so many things in my life that are hard, is practice.
Yeah.
Practice in a safe place. A lot of people don't always have a safe place, and I understand that. And they don't always feel safe within themselves even. But if you can find one person, yourself, a power greater than yourself, whatever that might look like for you, and start using your voice. Not even necessarily out loud. It could be in writing, it could be in thought, it could be in prayer, it could be however you need to do it. But start trusting that voice. And when you ask for something, maybe it's a prayer, or maybe it's something that you're trying on for size and it works, accept it for what it is. Don't say, oh, that was a fluke, or don't say that was, a coincidence. Like, accept it that, yeah, because I do believe that we can grow. I didn't always trust my voice, believe me. And sometimes now I can still doubt it if I want to crawl into my head too far. But practice, practice. And then as you get more comfortable in that little bit, practice, expand it out.
Wow. So these are all things that can change. We don't have to think, oh, well, it's been like this for 50,
No,
60 years. We can, it's all learnable skills.
absolutely. I mean, I see people come into recovery, 70s, even 80s, and their lives start changing. And I'm not saying you need recovery to do that. There needs to be an openness to do that. There needs to be an honesty to do that. There needs to be a willingness to do that. And I believe anybody, if it is something they want to do, can do. I mean, there's people I know are never going to change because they don't want to.
Yeah, I think it's to start with a want. I love you talk about how you journal and that you rely on journaling a lot and how you gave your emotions a voice. Do you want to talk like how you gave anger a voice? I think that is such a beautiful tool that I never thought of. I journal a lot, but it's more in how I feel or whatever. Talk to us how your process of journaling, giving anger a voice or giving something a voice, and how does, how does,
Well, I mean, I've heard it done different ways and called different things, but what I do is if I'm feeling something and I just cannot get through it, if it's just too strong and I don't understand it, I will sit down and I ask, whether it be anger, it can be grief, it could just be, what am I supposed to know today? But a lot of what I talk about in the book, it's like, okay, dear, you know, anger, what do you want me to know? What do you want me to know? And and then started, dear Caron, this is your anger and this is what I want you to know. And just get out of your head and let the pen go, or type it, or however you do. I like to handwrite it just because I think there's a greater connection. So many people, though, are so connected to keyboards that became their greater connection. But just write it. Allow that voice to come. And what I tend to do, I don't always do, but then I respond. I might respond and say, well, dear
as
anger,
you really,
as
do you
me.
then respond to anger?
Yes. Yes. But I always give the emotion the first voice.
And does it just come through you? I need to try that.
Oh, absolutely. And it can be anything. It can simply be, and it doesn't have to be anger. It could be, okay, divine love, what do you want me to know today? Or it could be whatever, but it has helped me through my emotions in so many ways. Yeah, I used to write like that with my grief in a big way. That was a very big thing.
Is it a once off, or does anger or grief or the emotion have different stories you need to tell you if you do it, or do we do it tomorrow and then it tells you a different story, what it wants you to know?
I don't know if it tells you a different story. I don't know that it's ever told me a different story. It might tell me more clarity because sometimes I might not be ready to hear everything that needs to be said. And so it might come a day, a week, a month later, and I might be in a position that I could receive it. Because I don't believe I lead breathwork classes and people want to have these big releases. And And then people are afraid to have the big releases. And it's like, you are not going to release anything that you're not ready to release. You are not going to bring in anything you're not ready to bring in. And I've just learned that over the years because that's just been my experience. And I've seen it with other people. And, and some people are really scared. I mean, when you talk about addiction, who will I be if I'm not this person? Who will I be if I put the alcohol down? Who will I be if I'm not shoving food down me so I don't have to feel? Like, who will I be? And there's a saying in some of the recovery books, like, I don't want to be a hole in the donut. I don't want to be like nothing because this has been so much of who I am. So it's very scary to let go of things, even the harmful things, even some really horrific things. Sometimes because it's familiar, we've grown to, like, we know it's not good for us, relationships, but it's what we've become familiar with, and we come to believe that that's what we need to do. And it's scary to go outside that. So yeah, when you're going through this with anger or with whatever emotion you're feeling, it could be whatever it is, shame, guilt, you might not be ready in the first sitting to receive everything. So you'll get what you need to go on to the next. And as you become ready, you'll be shown. It's a practice though. It really is a practice.
It
Isn't
seems
everything?
like we all, it seems there's a lot of practicing we need
I
to.
practice every day. I actually was writing about that this morning. I was like, one of the things I have to practice the most is practice.
You mentioned you facilitate breath work. Was it something that happened after part of your new post heart attack life, or?
I've been certified in a few things that have helped me over the years, and I, of course, then want to bring it. Well, the breath work, um, a friend of mine who actually we lead classes together, she had the experience of this conscious connected breath work. It's an open mouth breath work, excuse me. And she's like, you got to try this. And I'm like, okay. And I actually practiced it with a teacher on Zoom. And I wasn't having these big releases or anything like that, but I was, something was shifting. I knew something was happening and I wanted more and I wanted to learn this. I wanted to bring it to people because I just felt like it was something that needed to be known. And again, I didn't have a huge shift. I didn't have a huge release. So I went to Denver about 6 months after I tried it and I got certified in this particular breath work. And we came back, we already had a class lined up and we've been teaching it every month. It's been 2.5 years now. And it is the most efficient, effective modality to help release grief, trauma, pain out of your nervous system. It's absolutely my favorite modality of anything. And I have tried so many different healing things.
How does it relieve pain? I can understand the emotional release, but
Mhm.
pain is a physical sensation in the body. How does breath work? Does it help for pain? What type of pain?
Well, and that's a good question. Where is the pain coming from? Because a lot of times, is it maybe there are some pains that can't. There is something that you need more work to make it happen. But there are some things in our body that I truly believe are there from trauma, from grief, that it comes out sideways. If we don't tend to it, we can have pain, whether it be in our back, our hips. I know sometimes if I need really do some work, my hips will be in a great deal of pain. And so when we release certain things, maybe something is pushing against something, we can release that. I've seen things people like have felt like something has been removed from their body, something that has been there and it's been removed. Yeah, it's incredible. It's incredible.
That's interesting. Yeah. And what's the type of breath work? Conscious
It's called
breathing.
conscious connected breath work. And it's an open mouth breath work. It's there's 2 breaths in, 1 breath out. It's circular. There's no beginning, no end. I've had people, when we first started doing it, people wanted to come just to, support me and like, oh, let's do breath work. And they thought they were coming to just, which is great. Love that. The soundtrack that we put together a playlist based on whatever the theme is. I think our next one is connecting with your truth. we create a playlist and think spin class. You know, it is loud, it is fast, and then it kind of takes you on a roller coaster. We end it with, which is, I always say we come for the scream. At the very end, we hit a gong like so loud and you do a primal scream. I mean, we encourage the loudest scream you could even imagine. And then we do a sound journey with some crystal bowls and bring you down and bring you back.
Where do you do your in New York, doing it upstate, or where do you?
I'm in Syracuse, New York, so central New York. I'm very north. I do most of the practice at Center of Sound and Ceremony, right in downtown Syracuse. I'm learning to do it Zoom, so I can do more, but that's not my favorite way of doing it. So I haven't dove too deep
I would
into
imagine
learning.
the energy of in the room and the energy with people is much more effective.
I love it. And I know when I experience, because I still will do a class with my teacher on Zoom, and it's just not the same experience. I mean, it's good. And I mean, it is a great experience. It's just for me, I like to be around it.
Yeah. So what's next for Caron? You are out for how many years? 4 years, 3 years
I am
post
3.5 years post heart attack.
heart
Yeah.
attack?
It was the winter
And
solstice of 21.
and it seems life is taking or is taking a course of its own in writing. Are you planning to write more books? How are you planning to dedicate your next stage of life or this stage of life?
I was gonna the second stage, but this is my second stage. I don't know how many stages. It's kind of like I was listening to your meditation about seasons, and there are so many. There's more than 4. Yeah, I really want to be able to share more on this. I would love to be able to talk more, share more, get on some stages. And I love the Q&A. I have a bunch of library events coming up, and I'm really excited about that because I just love the people who show up and have the questions, and they're just, I don't know, there's just something about that I really enjoy. And I am looking to do another TEDx talk or TED talk would be great. I'm looking to do that and just share them. And it's so much more than the heart. It started with the heart. My daughter gets very upset when I just focus on the heart of it. She goes, because if it was just the heart, she wouldn't read my book. And she goes, and it's so much more. And it is. And it just has taken on so much. So depending on the audience is where I go to. But the heart, women's heart health, it really is the guiding force.
And I hope the world wakes up to it. And I hope the world, will catch up and help women or do more research about that topic. But you are 100% correct, because advocating for yourself, all of the things that you're teaching, take up space, listen to yourself. It's not just for your heart, it's for your life. It's for everything in your life that we can learn the skills. And I'm so happy to hear we can learn it. And it's not just,
Absolutely. No,
this is it, and now we're screwed, basically.
if it's important and it's a priority, it can be done, and I believe that because there's things that I'm resisting that I really want to do, and I will resist until I do otherwise.
As we close off the conversation, any last thought, little pearls of wisdom or nuggets you want to leave as your legacy of Her Second Stage podcast?
Well, I'm just going to go with what popped into my head. I don't know why it popped into my head. And it's like we're so focused on women, and we need to be focused on women because we need to give women a voice. For any man brave enough to listen to this, or any man brave enough to see me wherever, but to listen to this, trust her. Trust her. I don't know why that just popped into my head, but that did.
Thank you. I'm not going to add to that because that's powerful. Thank you very much for doing it today.
Thank you.